South Australia's new Premier has relaxed COVID-19 close contact rules, as the state records 4,549 new cases and 4s linked to the virus. Key points. Quarantine period for household close contacts will be reduced from 14 days to 7 days. Quarantine period for household close contacts will be reduced from 14 days to 7 days. Close contact definition will change from tomorrow. Close contact definition will change from tomorrow. Mask rules expected to ease on April 14th. Quarantine for household close contacts has been reduced from 14 days to 7 days, effective immediately. This is about bringing South Australia into line with the rest of the nation, Premier Peter Malinauskas said. Close contacts must have a negative PCR or rapid antigen test to leave quarantine. Mr. Malinauskas also announced that as of 12:01 a.m. tomorrow, the definition of a close contact will change. To be classed as a close contact, someone will have to have spent 4 hours in face-to-face unmasked interaction with a positive case, or be a household contact. Previously, the defined time period was just 15 minutes. The definition change does not apply to existing close contacts, who will need to complete their quarantine period. Peter Malinauskas says the changes will bring SA in line with other states. The government will also extend the time frame. Previously infected people are exempted from consideration as close contacts, from 8 weeks to 12. Meanwhile, the state's total number of active cases sits at 28,198, and comes a day after South Australia recorded its second highest daily caseload on record. The 4 COVID-linked S include men in their 30s, 40s and 80s, and a woman in her 90s. The state has 157 people with COVID-19 in hospital, including 6 in intensive care. Mr. Malinauskas also flagged that mask rules will be relaxed on April 14th, unless significant changes occur. However, people attending events at Adelaide Oval will now only need to wear masks when entering and exiting the Oval, and in fully enclosed indoor areas. If you're at the footy and you're lining up for your chips and a Coke, or something else, then you will not have to wear a mask unless it's in a fully enclosed environment, which of course most places aren't at Adelaide Oval, Mr. Malinauskas said. Grant Stevens will seek another 28-day extension of the Emergency Management Declaration. Mr. Malinauskas, who has also ruled out extending school holidays due to COVID pressures, said he was really happy to announce the rule changes. "I don't think we want to be popping champagne corks just yet about COVID, there's a long way to go," he said. "We know that COVID is going to be with us for some time, and the risk of new variants and the like is going to be with us for a while. But the simple fact is these rule changes will make it easier for the families of South Australians, and that is a good thing." Police Commissioner Grant Stevens will also seek a further 28-day extension of his powers under the Emergency Management Declaration, due to expire on April 1st. Despite previously stating he hoped the current extension would be the last, Mr. Stevens said continuing the declaration allows SA Health to compel people to quarantine and isolate. "We think we're close to the end of this in terms of having to manage it so proactively, so there's no justification to change the way we're dealing with it," he said. Chris Picton says urgent work is underway to make sure the health system can manage in the coming weeks. Chief Public Health Officer Professor Nicholas Spurrier said the state was in a BA.2 wave, and relaxing both masks and close contact rules now would result in a significant increase in cases and hospitalizations. However, she said South Australians could feel fairly confident about the mask rules being relaxed at Easter, after the peak of the wave. "I'm certainly feeling pretty happy about that. I'm pretty excited about that as well," she said. Newly elected Health Minister Chris Picton said very urgent work was underway to ensure the health system could manage under predictions of up to 150 COVID patients a day in hospital in the coming weeks. "All options are of course on the table, including, sadly, if elective surgery has to be cancelled down the track," he said. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15 m. Will winter bring a COVID-19 onslaught?